my first block of third-year rotations, 4 weeks inpatient, 4 weeks outpatient, and boy, was it an interesting ride. More than just learning about pediatric patients, I also had to learn about what it means to be a third year, like how you fit on a patient service, how to write notes, how to present to attendings and residents, what to do, and all that can be really difficult being a third year. It's part of what they call the hidden curriculum, where there's a bunch of things and lessons you gotta learn and do that no one ever really writes down for you, and you kind of just have to learn it as you go. And it can be really stressful and difficult, especially for people who have, only been in pre-clinicals for the past 2 years, and for people who haven't worked before. And I think in order to make sure you don't have burnout from those things, you gotta take in the positives. Like when a patient tells you, hey, you're gonna be a great doctor, or when a resident or attending tells you, hey, you did a great job today. That's really important to keep close to your heart. When all these other kind of more administrative things that you gotta do creeps in. I also had the pleasure of getting to do a 2-week emergency elective, which was absolutely awesome. I loved it. It was a little terrifying because I've never done adult medicine before this point, and trying to talk to an 80-year-old person who has a bunch of health problems and trying to figure out, are they going to die from what they have right now? That was really stressful, but I loved it. There's so much variety, it's so much fun. But what's really upsetting in emergency medicine isn't practicing it. It's seeing patients who come in with chronic, terrible health problems, like really, really chronic knee pain, or chronic migraines or something like that. They aren't able to see a PCP or specialist in the time that they want. Like they're having to wait 3-4 months to see someone, and in the meantime they're living with these problems, and they finally come to the ED because they're like, I can't live with this anymore. But we can't do anything to expedite them needing to go see their PCP or specialist. And it kind of highlights how broken the healthcare system we have here in America is, that patients aren't able to either pay for their health, or they have to wait so long for these issues that are really affecting their lives. And it just sort of solidified my conviction of why I got into health policy, why I'm doing medicine at all. And I think it's really important for anybody who's going to medicine to remember and to figure out, like, why is it they went into medicine? So I'm really glad that I'm able to see why and remember why I care, why I want to be in health policy. So what makes you tick? What makes you want to do medicine? What makes you care? Figure that out, and you can survive med school.